Urinary tract infections, UTIs, are typically caused by bacteria entering the urinary tract and multiplying in the bladder, urethra, or kidneys. The most common cause of UTIs is the bacterium Escherichia coli, E. coli, which normally resides in the intestines but can find its way into the urinary tract. Here are some of the main causes and risk factors for UTIs. Bacterial entry. Bacteria can enter the urinary tract through the urethra and travel up into the bladder and sometimes the kidneys. This can happen due to improper wiping after using the toilet, sexual activity, or the use of catheters or other medical devices. Sexual activity. Sexual intercourse, especially in women, can introduce bacteria into the urethra and increase the risk of UTIs. This is sometimes referred to as honeymoon cystitis. Urinary retention. Incomplete bladder emptying or urinary retention can create an environment where bacteria can thrive. Menopause. The hormonal changes associated with menopause can lead to changes in the urinary tract that increase susceptibility to UTIs. Blockages. Any blockage or obstruction in the urinary tract, such as kidney stones or an enlarged prostate in men, can lead to UTIs. Catheter use. People who require catheters to empty their bladders are at a higher risk of developing UTIs because the catheter can introduce bacteria into the urinary tract. Weakened immune system. Conditions that weaken the immune system, such as diabetes, HIV/AIDS, or certain medications, for example, immunosuppressants, can make a person more susceptible to UTIs. Anatomy. Some individuals may have anatomical abnormalities that make them more prone to UTIs. Poor hygiene. Not maintaining good personal hygiene, particularly in the genital area, can increase the risk of UTIs. Use of spermicides and diaphragms. Some contraceptives like spermicides and diaphragms may increase the risk of UTIs in women. Dehydration. Not drinking enough water can reduce the body's ability to flush out bacteria from the urinary tract. It's essential to seek prompt medical attention if you suspect you have a UTI, as untreated UTIs can lead to more severe infections and complications, such as kidney infections. UTIs are typically treated with antibiotics prescribed by a healthcare provider. Additionally, practicing good hygiene, staying hydrated, and taking preventive measures, such as emptying the bladder before and after sexual activity, can help reduce the risk of UTIs.